For anyone struggling with chronic heartburn, that painful burning sensation in your chest or a sour taste in the back of your throat, you know how desperate you can get for relief. You grab antacids, you change your diet, but the burning always comes back. But what if the over-the-counter medication you are taking to fix it isn't working because you are using it completely wrong? This is Eugastrol Reflusso 20mg gastro-resistant tablets. It is a highly popular, clinically proven treatment for acid reflux, powered by the active ingredient pantoprazole. But unlike quick-fix antacids, this medication follows a strict biological timeline, and if you don't understand how it works, you might end up wasting your money, or worse, masking a much more serious gastrointestinal issue. In this video, we are breaking down the exact science of how it shuts down acid production, the crucial rule for when to take it, and the absolute deadline for when you must stop using it. Stick around until the very end because using this incorrectly could completely ruin its effectiveness. Welcome back to the channel. Today, we're conducting an essential international medical breakdown of Eugastrol Reflusso 20mg gastro-resistant tablets. Before we look at how this medication interacts with your stomach lining, a vital medical disclaimer. This video is strictly for international educational purposes. Eugastrol Reflusso is an over-the-counter short-term treatment, but it should never replace professional medical advice or a formal diagnosis from your gastroenterologist. To understand why Eugastrol Reflusso is so effective, we have to look at how your stomach actually creates acid. Inside your stomach lining, there are millions of microscopic pathways called proton pumps. When you eat, these pumps actively spray hydrochloric acid into your stomach to digest your food. When you take a standard antacid chewable, it simply floats on top of the pool of acid, neutralizing it for an hour or two before your stomach just pumps out more. Eugastrol Reflusso works entirely differently. As a proton pump inhibitor, or PPI, the active pantoprazole travels through your system and directly binds to these active proton pumps. It effectively turns the switches off at the source. Instead of fighting the acid that is already there, it stops the acid from ever being created in the first place, allowing your irritated esophagus time to finally heal. Because of how pantoprazole works, you cannot treat this like a rescue medication. You cannot take it right after a heavy meal and expect immediate relief. The chemical structure requires time to build up in your system. Clinically, it takes 2 to 3 consecutive days of taking Eugastrol Reflusso to experience its full acid-blocking power. The golden rule for maximum effectiveness is to take exactly 1 tablet once a day, first thing in the morning, 30 to 60 minutes before your very first meal or breakfast. This ensures the medication is fully absorbed and ready to block the proton pumps right when they try to activate for digestion. Furthermore, look closely at the box. These are gastro-resistant tablets. They are manufactured with a specialized outer coating designed to survive the harsh environment of your stomach so they can dissolve properly in your intestines. If you crush, chew, or break these tablets, you completely destroy that protective barrier, making the medication useless. Always swallow them completely whole with a glass of water. Finally, we must talk about the strict safety limits of over-the-counter PPIs. Eugastrol Reflusso is explicitly indicated for short-term treatment. You should not take this medication continuously for more than 14 days without direct medical supervision. If your severe heartburn or acid regurgitation persists after the 2-week mark of daily use, your body is telling you something. Suppressing stomach acid for prolonged periods can interfere with nutrient absorption, like vitamin B12 and magnesium, and it can mask underlying conditions like severe gastroesophageal reflux disease, ulcers, or even esophageal changes. If the 2-week mark hits and you still rely on it, stop the medication and book an appointment with your doctor. Eugastrol Reflusso is an exceptional, scientifically backed tool to conquer chronic acid reflux, but only if you respect the timing, protect the tablet coating, and honor the 2-week safety limit. If this international medical guide helped clear up your confusion today, make sure to hit that like button right now. Subscribe to the channel so you never miss another evidence-based pharmaceutical breakdown, and let me know your thoughts or questions in the comments below. Stay informed, protect your health, and I will see you in the next clinical review.